Do you need an MRI, X-ray, ultrasound, or any other image of the shoulder? For most of us, the answer is surprisingly no. Imaging can be a powerful tool that has helped discover many life-threatening injuries and abnormalities, but with every great tool comes its own negative issues. Sometimes an image tells us too much. For instance, take a look at my forearms here. My right arm here, relatively clear, just a few freckles, no big abnormalities. My left arm, on the other hand, you can see these big moles here. But in reality, they're both healthy. In fact, my left arm is a little bit stronger. So I'd say it's even healthier than my right side, despite these little abnormalities on the skin. So just like we have these issues on the outside of our skin, these perceived problems, we can also have these moles, so to speak, on the inside of our body as well. So the scientific term for this is an incidental finding, which means that when looking for some kind of a problem with an MRI or X-ray, you discover an anomaly that is completely unrelated and unexpected. For example, in one study, of all those with rotator cuff tears found with imaging, only 34.7% were symptomatic, meaning 1 out of 3 people with a rotator cuff tear have some sort of pain or discomfort associated with the tear. This means despite having a rotator cuff tear found with the image, a person may not have any shoulder pain or issues associated with it. So even though an MRI or ultrasound image may find something abnormal, this does not mean that this finding is causing your shoulder symptoms. Who does need an MRI? So for cases where a traumatic injury occurs, for instance, somebody falls and maybe dislocates their shoulder, or if there's some sort of abnormal growth found during the physical exam, then maybe that's a case where an MRI would be beneficial. But even in these cases, an image should just be one tool to be used with a combination of other findings taken from the patient's history and a full comprehensive physical exam. So for everyone else, they probably don't need an image. So what's the harm? I hear all the time from patients, why can't I just get the MRI? What's the harm in me just finding out what exactly is going on? Well, there's a few reasons. One, it's a waste of time, it's a waste of money, and can also increase your anxiety as well. For instance, once you see on that MRI that you have a rotator cuff tear, it's really hard to think otherwise that that's not causing your shoulder symptoms. And this, in some cases, has even led to unnecessary surgeries as well. If you go in and you find that there's a rotator cuff tear, there are some people out there that want to fix that rotator cuff tear even though it's not causing your symptoms. This can lead to a painful procedure that you never even needed in the first place that doesn't even solve your problems. So who can help with your shoulder pain? A great physical therapist can. Someone who looks at the whole body, not just one area. We are trained to figure out how to solve your shoulder pain without expensive imaging, painful surgeries, or injections, so you can get back to doing the things that you love. If you want to learn more about the shoulder, check out the blog post below in the description. And if you're in the Massachusetts area and are dealing with shoulder pain, check out Your Physical Therapy to schedule an appointment.